Today on the Nourishing You podcast.
Because with every spoonful, with every forkful, we are either feeding disease or we're feeding our health. And everybody's got to eat anyway. So we might as well be eating to feel and look our best so we can enjoy our health and vitality for as many years as possible.
What do you like? Tell me what you like.
There's value in that because it almost gives the brain like a vacation, right?
Holistic health is completely underappreciated, but so critical. Eating whole foods, and the key is just to find something that you really enjoy.
Welcome to the NAMP Nourishing You podcast. I'm Kristen Burkett.
And I'm Diana Wally. We're your hosts for NAMP's podcast dedicated to connecting holistic health enthusiasts with each other to share practical information from the holistic wellness space for enhanced vitality.
Diana and I are master nutrition therapists, board certified in holistic nutrition with private practices and an online joint venture that supports clients and practitioners as they strive to reach their full potential. We're honored to be hosting this podcast for NAMP and connecting our listeners with the latest in holistic wellness.
If you enjoyed today's show, help us out by commenting below, liking this video, and subscribing to the channel to help us spread the word.
Hi, everyone. Welcome to this episode of the Nourishing You podcast. We're honored to talk with Dr. John Neustadt about understanding osteoporosis today. Dr. John Neustadt has spent nearly 2 decades as a clinician, researcher, writer, and entrepreneur. Dr. Neustadt earned his naturopathic medical degree from Bastyr University, where he was awarded the Founders Award for Academic and Clinical Excellence. He opened his clinic, Montana Integrative Medicine, in 2005 in Bozeman, Montana. Dr. Neustadt specialized in hard-to-treat chronic degenerative diseases through an integrative approach that emphasized identifying and correcting the underlying causes of disease. In 2011, he relocated to San Diego, California. He's a frequent speaker at medical conferences, and his research on osteoporosis, sleep, diet and inflammation, herb-drug interactions, musculoskeletal pain, healthy aging, and proteomics has been published in multiple reputable journals. He was recognized by the world's largest medical publisher as one of the top 10 cited authors in the world for his work and received more than a dozen U.S. FDA orphan drug designations. Dr. Neustadt is on the Corporate Advisory Roundtable for the Bone Health and Osteoporosis Foundation and is vice president of the California Association of Naturopathic Doctors. His latest book, Fracture-Proof Your Bones, A Comprehensive Guide to Osteoporosis, teaches readers how to find and eliminate hidden dangers that cause osteoporosis and fractures, how to create a holistic plan using diet, lifestyle, exercise, and dietary supplements to protect your bones, and how to talk to your doctor about medications and osteoporosis to make sure you get the best possible care. Welcome, Dr. Neustadt. We've been looking forward to talking with you today.
Thank you. I'm so excited, and my mother would be so proud of that introduction.
It is quite an introduction.
Thank you. I'm really hearing it. I'm like, who is that guy?
So congrats on the release of the new book, which is fantastic, by the way. Everyone needs a copy. And, with the book launch, we thought it was perfect timing to have you on the podcast to talk about osteoporosis. And I should say that this is a really important topic for everyone, young people to the elderly. So for the young listeners, don't think this doesn't apply to you, because it does. But first, before that, we want to get to know you a little more. So can you tell us about your background and how you became interested in the topic of bone density?
Well, thank you for the opportunity for me to share what I've learned and to help people learn about the book and what they can do about their bones and their health. For me, I never imagined that I would specialize in this area, that I would become an expert in osteoporosis. A clinical mentor of mine, when I was in medical school, in response to a question that another student asked about specializing in clinical practice, he said, "Your patients will tell you what they need. If you listen close enough, they will tell you what they need." And what happened in clinical practice is I was seeing my patients and somebody came in with osteoporosis. And I thought I was doing a good job. I was looking at their bone density and working with them on some holistic approaches and, diet and lifestyle, some of the foundational things that I talk about in the book, but have definitely matured and developed since then. And I thought I was doing a good job. And then I had another osteoporosis patient came in. I thought, great, I'm helping them. And then my mother-in-law, who has osteoporosis, fell and broke her leg. And she was on Fosamax. Her doctor was happy because her bone density was going up, and she was happy because her bone density was going up, and they thought she was protected. And at the time I did too. But that was a real wake-up call for me. I said, what is going on? And I started looking at the research, and I realized the limitations of the bone density test and the over-reliance on the bone density test are leaving millions of people woefully unprotected. And it's really about understanding ways to reduce fracture risk beyond just a number on a test, which is not a very good predictor of fractures. And I started researching and trying to understand, what can I do? How can I do this better? How can I help more people? And 20 years later, here I am.
That's such a heartfelt story. And I think when we have these personal connections, it leads us into such, a deep-rooted research and connection with the topic. And you definitely are showing us how that led you on that path. And we're certainly thankful that you landed on this topic, because it's much needed, and obviously being underrepresented in the way people are being led to believe about their bone density and what's right for them. So I find it interesting. Once somebody has a diagnosis in osteopenia or osteoporosis, it becomes sort of a crisis, and people start to panic about, what do I do? How do I fix my bones? Now it's an issue. But I'm sure there's a lot more to bone health before we get to that type of diagnosis that we need to be more informed about. Can you start us off by sharing with us and explain why we should care about bone health and some of the statistics that go with maybe poor bone health?
Absolutely. So bones allow us to move, hug our loved ones, enjoy activities, and really are more than just, strong, kind of stick, long, hard things inside of our body that let us move around. Bones are actually part of our endocrine system, our immune system. They affect blood sugar control and insulin with proteins that they produce. They also are our factories for manufacturing blood, red blood cells, white blood cells, platelets. So bones are more than just about bone density. They're more important than that. They're truly miracles. And what happens as we are growing and aging, peak bone mass happens in our 20s to mid 30s. And then from there, typically the research has concluded that people start losing bone mass at about 2 to 3% per year, starting in their late 30s, early 40s. And so by the time they get to 50, 60, they really are not, their bones aren't as healthy as they could be, because it's important to understand, and I really want to drive this home. People think, and I believe that historically medicine has talked this way, that bones are inanimate objects, that it's a one-way street. It's all downhill once you attain peak bone mass. But we know that that's not true. It's a living, dynamic system. And bone remodeling, old bone being broken down and new bone being built up, is constantly happening. Every 10 years, in fact, your bone is completely turned over, completely new. And so the foundational approach and concept is, okay, what can we do to remove things from our life that are destroying bones and give our bodies what it needs to build stronger bone, either to stay strong and stay healthy, or rebuild bone once it's started to weaken. The statistics, if people get osteoporosis and fracture a bone, are frightening. So first of all, the risk of osteoporosis goes up as we age. And postmenopausal osteoporosis is the most common type of osteoporosis. 80% of women of osteoporosis cases are in women. But even with postmenopausal osteoporosis, where people think that it's just because of the decrease in estrogen, 30% of those cases are due to other causes, not just the drop in estrogen. So there's lots of things that we can do to help. And if you have osteoporosis and you break a bone, there's up to a 36% chance that you're going to be dead in a year. If you happen to survive that year, there's a 60% chance that you will never regain your full pain-free level of mobility and lifestyle that you had before. And right now, and this is not in the book because I just heard this the other day, I was shocked. There are more people on the planet today over 65 years old than younger than 5 years old. So we are really looking at a tsunami of cases. And the paradigm right now of just focusing on bone density is insufficient to helping people. In fact, in the US, there is a woman has a greater risk of getting an osteoporotic fracture than she does of getting breast, uterine, and ovarian cancer. And osteoporosis accounts for more days spent in the hospital than heart attacks, diabetes, and breast cancer. So the statistics are frankly, for me, scary and horrifying.
I would love to talk a little bit more. You mentioned the fact that bones that affect blood sugar and insulin. Can you dive a little bit deeper into that? Because of course we're seeing a tsunami of metabolic disease in the United States as well. And then I'm curious, does it work the other way? So if you have high blood sugar and insulin issues, does that then affect your quality of your bones?
So there is no clinical trials looking to reverse that. It's a very complicated, dynamic between blood sugar and bones. What we do know is that as bone health goes down, that blood sugar, there's more blood sugar dysregulation. There's a strong association between the two. And there are proteins in the bone that interact with the pancreas and with insulin and interact with cells in the body for blood sugar. And so it is a complicated, I think, dance of hormones. It's not, this is emerging research. It's not fully teased out, the interplay. But we do know that as bone health goes down, there's a strong association between poor blood sugar control and insulin resistance.
That's fascinating. I'd never heard that before. I'll be really interested to see as that research comes out, what we learn from that. And it just, it speaks to that point of what you said about bones are more than things that hold our body together. I mean, they're living parts of our body with lots of functions, and I don't think we give them the credit that they deserve.
There's a whole chapter in my book called Miraculous Bones, because I really think when there's the old saying, familiarity breeds contempt. Well, I actually believe the opposite, that familiarity breeds respect and understanding and awe. And I am just in awe of how miraculous our bones are.
Yeah, truly amazing. You mentioned a statistic that caught me, and I've wondered about this in the past. All the statistics are staggering, but you said that the incidence of dying after a hip fracture with osteoporosis is a 36% chance in the first year. Can you explain why there's this association with death after a fracture? What's the cause of death that comes to play? I think I've heard that before, but I never really understood why.
So it starts a cascade of events, a downward spiraling in a lot of people's health. So people who break a bone then become more sedentary. And when you're more sedentary, it can increase the risk for blood clotting. There's also inflammation involved. Inflammation can reduce hunger, and so their nutrition may go down. They can become depressed, which also can reduce their desire to eat or move and interact with other people. And it could leave them susceptible, that's being sedentary, to other infections like pneumonia. That statistic, the highest risk of death with that statistic is with people who have osteoporosis who are 65 years and older. And oftentimes in that population, there are other comorbidities as well. So there could already be diabetes, there could be COPD, there could be hypertension, there may be kidney disease. There are other factors. And the research has shown that as people with comorbidities, people with comorbidities are at a higher risk for dying from osteoporosis and fractures.
Okay, so it's not the actual osteoporosis that's linked to the death statistic, but probably more the loss of mobility and how all of these other things begin to cascade and multiply on top of the fact that somebody is now more immobile and can't do the things that would help prevent those other pieces from coming to play. Does that sound right?
That's correct. There are some direct results of the fracture, like inflammation, that can play a role in that. But yes, it tends to be the event that starts this kind of downward spiral in a lot of people, which is why it's not an immediate thing. You break a bone, you're not immediately dead. We're talking within 12 months. The biggest risk is within the first 6 months. And then the risk begins to decline if you can survive 6 months. But even if you survive that year, you're looking at 60% of people who have chronic pain and difficulty doing activities of daily living and just enjoying the life they had before the fracture.
It's really unbelievable. That statistic also jumped out at me, Kristen. And not to mention what being sedentary or forced bed rest does to muscle as well. So the sarcopenia that can begin, it's really, really sad in a short period of time as well. And this is kind of a statistic that I recently heard that kind of goes along with what we're talking about, is that 70% of 70-year-olds are unable to get off the floor using even both of their hands.
That's incredible.
Isn't that incredible?
That's shocking.
I know, which goes to bone health. And I work part-time as a personal trainer with elderly people. It's a real love that I have, and along with my nutrition work. But when I heard that, guess what I had all of my people doing? Today, we're going to practice getting up and down off the floor. So, and we're going to be superstars because we're going to do it with one hand, not with two. So I know that it's just, these statistics are just very upsetting.
Right. And one of the reasons why you get that sarcopenia happening is because people chronically aren't getting enough protein. So the research has shown that the US RDA for protein for adults, which is 0.8 to 1.2 grams per kilogram body weight per day, is insufficient to maintain muscle mass in the elderly, 65 years and older. So that the research shows that you've got to have more than that. There are clinical trials looking at giving 1.3 or 1.5 grams per kilogram body weight per day. And along with resistance exercise, maintaining and actually growing stronger muscles. And so those nutritional deficiencies or insufficiencies that may be there have a pivotal role in whether somebody falls, fractures, and ultimately dies, because 95% of fractures occur because somebody falls. So anything we can do, your work with your clients is phenomenal, because anything we can do to prevent a fall can prevent a fracture.
Yeah. So there seems to be a lot of emphasis in our society on screening and medicating for other chronic conditions, cardiovascular disease, breast cancer, lots of screening things in place. Do you feel that we're doing the same for osteoporosis, or where are we on that spectrum?
Oh, we absolutely are not. I mean, the research is clear that eligible men and women, a majority of them, are not getting screened with a bone density test. And despite the limitations of the test, and let me put it in its proper context, a bone density test only predicts 44% of women who will break a bone, and only 21% of men. So it's not very sensitive. It's not very specific. We've known that since the 1990s. This is not new information. In fact, the North American Menopause Society, their published position statement, and anybody who's looked at the research correctly has concluded that fracture risk depends on factors largely other than bone density. But the research is clear. In both Medicare system and non-Medicare system, the majority of eligible patients are not getting screened with a bone density test. And despite its limitations, a bone density test is important. It's important to get because it's one piece of the puzzle. And it also allows you to understand how aggressive to be. It opens the door to a conversation, and to help people start modifying their lifestyle and behavior and taking steps proactively to protect their bones.
So I feel like my fault, we got a little ahead of ourselves maybe. So if we could take a step back and define a couple of terms for the listener. So we'd love to know your definitions of bone density, of osteopenia, and then osteoporosis.
So my definition of bone density is the same definition of the Society for Clinical Densitometry, the World Health Organization. It is based on a T-score that is generated by a bone density test. And the T-score measures somebody's bone density, which is the amount of minerals in the bone, compared to a 20-something person of their same gender and their same race. So if I were a 65 or 72-year-old woman, my T-score would be comparing my bone density to a 20-something female of my same race, right? And that is what's required. A bone density test is what's required to diagnose osteoporosis. That T-score is the diagnostic element that's required. And a T-score of -1, it's written as a negative because you're losing bones, you're getting less. -1 to -2.5 is osteopenia or pre-osteoporosis, and -2.5 and lower, -2.8, 2.9, that's osteoporosis. And that's how it's defined. It's very narrowly defined on that bone density test result.
Okay. How low does the score go? Like, how negative can it be?
Oh, that's an interesting question. I don't, in terms of the actual bone density, it's a radiological exam. What's the maximum minus number? I don't know. I've seen bone density tests into the -4, -4.5 range, which is severe osteoporosis.
Okay. And so if someone's going to get that kind of an assessment, that's a DEXA scan, right? And
correct.
When do people typically get that type of an exam, or when does that come into play?
So the recommendations are that if you're 50 years or older and break a bone, you should have a screening bone density test, a DEXA scan done. In general, it depends on the organization, but the recommendation that I think is most clinically, the best clinically relevant one, is that any women that are 60 years or older should get one. There are some recommendations if you are younger and you're on certain medications, you should get a baseline bone density test. Medications that we know strip bones of minerals or damage bone health. But in general, those are the recommendations.
And that's not an expensive test. Is that correct?
I don't know the cost of it, but insurance pays for it. Medicare pays for it.
Oh, great. Okay,
yeah,
good to know.
It's a standard
Great.
screening test, and every insurance company should be paying for that.
Oh,
and I think it depends on the insurance company as to what age they'll pay for it. Because I recently asked my provider, and I think I have to wait till I'm 65 if I want my insurance to cover it. But
correct.
That doesn't mean
However,
I couldn't self-pay for it or do it.
Correct. Or if they chart that you have risk factors for osteoporosis and you want a screening DEXA test, they should, if it's charted correctly, cover that if it's appropriate.
Okay.
And many people have risk factors.
Yeah, I'm pretty sure I saw in my area that, just to your point, Kristen, that I'm not sure I'm going to get a script for it. It was about $125, $150. So yeah,
it's pretty reasonable.
Yeah.
Right. So is it just women that typically get screened for this or that ask for it? How much does this apply to women versus men? You mentioned earlier that it affects both sexes, but I don't hear this conversation around men very often. So can you shed some light on that? How you mentioned it wasn't always an estrogen issue with women. So kind of tease that apart for us between men and women and the screening.
So the screening percentages in men is even worse than it is for women. And I don't remember off the top of my head, except for they're not getting screened as much as they should. 20% of osteoporosis cases are in men, 80% are in women. So in general, it's not on most clinicians' radar. But that recommendation, I've had 2 patients recently who reached out to me, men over 50, between 50 and 60. So not even in that 60-year-old age range, who broke a bone. And I told them, you really do need to go back to your doctor and ask for a bone density test. And because it was never even mentioned to them as something to do and look at, although that is a recommendation that you find out there from organizations and in the literature. So men in general just aren't on the radar. And part of the problem is because there is no specialty for osteoporosis. This disease is screened for and handled by general practice doctors who, the studies show, feel confused about what to do, how to screen, when to screen. And then when somebody does have it, confused even about which is the best medication. They're not trained, and very well-intentioned people. Their heart's in the right place, but they're just not adequately educated to have the complex conversations around diet, lifestyle, and exercise, besides simply just saying you should exercise, which exercising with osteoporosis, if done incorrectly, can actually increase someone's fracture risk. And in addition to that, if they're taking insurance, unfortunately, the insurance system is not set up for those longer, in-depth conversations the way that the doctors are compensated, because they're still compensated more on the volume of patients and on whether or not, if it's looking at outcomes, the outcome that's being looked at is just bone density alone, just a test result, but not actually serving the patient holistically to help them. And so that's why for men, they're just woeful. They're just not getting screened as they should.
I bet that's new information for the listener, that there isn't a specialty to deal with osteoporosis, that it's the PCP that handles it. And so just another reason why y'all need the book. This is where your book would be so helpful, because you really have to be your own advocate.
You do. It's very important. And one of the things that I'm passionate about is teaching people how to ask better questions. What are the questions to ask to make sure that you're getting the best information so you can make the best choices about your health? And in the chapter on osteoporosis medications, there's a whole list of questions to ask their doctor to make sure that the medication, first of all, is appropriate. So here's an example. I'm all for medications when properly prescribed and used. But if you've never had a fracture and you've got osteoporosis, there's only one medication that's been shown in clinical trials to prevent a first fracture from occurring, and it's intravenous bisphosphonate Zometa. The first line therapy is typically an oral bisphosphonate, like Fosamax or Actonel. That's never been shown to prevent a primary or first fracture. And so you've got to make sure to know what questions to ask. And then if somebody is put on a medication because it's appropriate, or they decide it's a good choice for them, it's important. I just had this conversation today with somebody in Canada. I was consulting with somebody in Canada, and she was recommended a medication, and it was appropriate for her because she already had an osteoporosis fracture. And so medications are much better at preventing a secondary fracture. But I asked her, so your doctor says he wants you on this for 3 to 5 years. Well, what happens after that? Did you ask him what's the plan after that? Does he switch you to another medication? What's going to happen? And she said, well, I didn't think about that. I don't know. So I go through and say, these are the questions to ask. And this is fundamentally the most important, I think, take-home message of the book, is that osteoporosis is simple in terms of how to approach it as a patient. No matter what somebody's recommending, whether it's a test or some intervention, the question is, if it's a test, how well does it predict my fracture risk? Not looking at the number on a test, but actually my fracture risk. And the other thing is, if it's an intervention, have clinical trials shown that what you're recommending will reduce my fracture risk given my diagnosis or my other medications that I'm taking? Because they're actually, for medication-induced osteoporosis, which is a very big topic and deal, most of the medications haven't been studied that destroy bones, haven't been studied with osteoporosis medications to show that they reduce fractures. And a study looking at proton pump inhibitors, which increase fracture risk, the acid blocker medications, where they were giving bisphosphonates as treatment for many years as standard of care, never any clinical trials on that. Well, somebody finally ran a clinical trial, and what they discovered is people who just took the bisphosphonate, the Actonel, or I think it was Fosamax, had a reduction in fractures. But people who took the Fosamax, who were also taking that acid blocking medication, their fracture risk increased, because the way that it damages a medication like the acid blocking or proton pump inhibitors damage a bone is different than the way the Fosamax or Actonel help to heal the bone or help to promote the bone strength.
Yeah, there's so many factors to consider. I have to say, I mean, when we have people on this show and there's books, I don't usually like promote the book so intensively, but I gotta say, so I showed him this earlier, I've got like so many tabs, but what I love so much, and this is so real to me right now because my mom is going through a lot of this decision making herself right now with her physician. And so she's asking for my input. And I said, well, guess what? I have this to refer to now. And so I've been quoting her things out of the book and sending her passages, and actually just sent her the book. But what I love is the checklist that you have, because for all these different aspects of how to work with your doctor, how to assess your own fracture risk, how to look at the different medications you might be on and those risks that they might pose to your bone health. You've got lists for everything to help people walk through and make this actionable. And you don't see that usually. So it's just such a great resource. It's not just information. It helps you take charge of what you want to do and be able to make confident decisions. So I love that part of it.
Well, thank you. And that means so much for me that I'm able to help your mother and my work can help her. And I was very conscious. It was a conscious decision to put at the end of a lot of these chapters is take action sections. Okay. Now you've read the chapter. Here's the action you need to take now. And to get a holistic plan together. As you said earlier in the interview, people are so frightened when they get this diagnosis. Yeah. And they come to me so scared, and there's this number on a test, this DEXA number, and they're scared to death. And what I do first, and what I do in the book, is say, take a deep breath. This is not an emergency. It's a problem, and you should and need to handle it and deal with it. But this isn't an emergency. There's time to do a little, to get some education, get your ducks in a row, and create a holistic plan for yourself.
Yeah. Well, speaking of creating a plan, if we take that back a couple of steps, can you talk to our audience about just what makes healthy bones to begin with? What do we need to have a healthy bone structure?
Bones are more than just minerals. People are familiar with the minerals in bones, but it's a complex tissue, and bone and minerals give bone its hardness. And that's important, but ultimately the minerals are not what give bones its ultimate strength. It's the proteins in bone and the collagen in bone. So 90% of type 1 collagen in the body is in bone. And if you've ever seen a rubber chicken, or had the toy, a rubber chicken, that's essentially what collagen is. Collagen is a triple helix of repeating amino acids, the collagen protein. And that's what gives bone its ultimate quality and its ultimate strength. The minerals are the quantity of the bone, and the collagen gives minerals its quality. When the collagen is healthy, it's flexible. It allows the bone to actually bend a little bit, right? And if you fall, that force is dispersed over a wider volume of bone, a wider surface area. The bone deforms a little bit. It can absorb that and not break. It's not brittle. But there are over 250 proteins in bone. It's also not just about the collagen. So I think what makes bone healthy is what makes everything else in our body healthy. And I talk about this a lot in the book. When you're following the healthy dietary pattern, which is a plant-forward diet with making sure you're getting enough protein and enough whole foods, when you're reducing or managing your stress levels and getting enough sleep, you're reducing your osteoporosis and fracture risk. You're creating the environment for your bones and your body to heal and be stronger. And you're giving your body the raw materials for your biochemistry to work better. And that includes your bones as well.
That's beautiful. Yeah. So you talked about, we touched on a little bit on sleep, and we talked about medications. As far as sleep, what do you see there? What kind of tips can you offer around that?
So as people get older, they tend to decrease in both their sleep quality and sleep quantity. So there are two domains when we think about sleep: the amount of sleep you get, and whether you're getting into that deep restorative sleep. And as people age, they tend to get less sleep and lighter sleep. And you can know that if your sleep quality is not as good as it could be, if, for example, you get woken up by just slight noises that may occur. That means you're staying in those, phase, stage 1 and 2 of sleep. You're not getting into that deep restorative stages 3 and 4, that deep sleep where it's harder to wake you up. So with sleep, the research shows that getting an average of about 7.5 to 8 hours is the sweet spot. That when people chronically don't get enough sleep, that's strongly associated with reduced bone mineral density. But in addition to it being associated with poor bone mineral density, what happens when people are sleep deprived, when they don't get enough sleep, the research has shown that it affects us. For example, if you're driving a car, people with insomnia are as dangerous and impaired as a drunk driver. And so it increases your risk for falling and other injuries. And so sleep has in people who aren't getting enough sleep, that is less than 6.5 hours a night, on average over time, it increases their risk for high blood pressure, diabetes, heart disease. The list just goes on and on. So making sure sleep is adequate is one of the foundations, one of the what I call the 4 pillars of health, that foundational element that is really important. And along with that, looking at medications is important, because some medications like beta blockers actually reduce melatonin. And as a lot of people know, melatonin is important and is crucial for helping us fall asleep. It helps regulate our circadian rhythms. And I talk about all of this in the book.
Well, and I never put put these two things together, the lack of sleep and the increasing fall risk, which is just really scary, because we talked about the dangers of falling. So I'm really glad that you highlighted that.
Good.
Sure. So since we're nutrition therapists, we might want to dive into diet just a little more, because it kind of floats our boat. But if our audience wanted to go out there and pick a diet off the shelf, because there's so many things they can choose from out there to try to help guide their choices. Mm-hmm. Is there a diet that you would recommend that as a template works well to support bone health?
I am so glad you asked this question. And the answer is a resounding yes. The most studied dietary pattern that is consistently shown to help reduce the risk of osteoporosis, and reduce the risk of fractures by 21% reduction in fracture risk is the Mediterranean diet. Not only that, it's been studied over 50, 60, 70 years without any negative studies that I've heard of, and been shown to reduce the risk of diabetes, heart disease, cancer, death from cancer, all-cause mortality, obesity. The risk goes on. And in that bucket also is reducing the risk for osteoporosis and fractures. So it's that Mediterranean style diet with a caveat. The caveat is that what I've discovered in at least in the population that I deal with, which is primarily the United States, the Mediterranean diet comes from the Mediterranean region. So it's a model way of eating. That's a plant-forward diet, high in whole foods, high in low in processed foods, lots of lean proteins. But even with the keto craze and high protein craze that is in the US, almost every patient that I talk to, when I do a diet recall with them, when I calculate how many grams of protein are they getting, they are protein deficient. Yep. And so they can think that they're following this healthy way of eating. And by the way, vegetarian and vegan diets are associated with lower bone density and poorer bone health than the omnivore diet. And part of that, there's some studies that did not show that, but the overwhelming number of them did. And part of the hypothesis or the thinking around why that's the case is not necessarily the quality of the diet in terms of the nutrition content of the vegetables, vegetarian or vegan diet. It's because they're not getting perhaps enough protein.
Yeah.
It comes up, I think, every conversation.
I was just going to say, I know.
Yeah,
and protein-centric.
Yeah, so I think I had this conversation 3 times today with clients about protein after doing the diet.
It's important. It's important. And green leafy vegetables, the higher consumption of green leafy vegetables has been associated with lower osteoporosis risk. So again, that plant-forward Mediterranean style diet. And in my book, in the chapter on diet, I give people the system that I've used with thousands of patients of how to help them transition into eating this way. And it's not a diet, and I really want to make sure that people understand this. When I talk about diet or the Mediterranean diet, it's not telling people what they can't eat. It's helping them learn and transition into how they can eat to promote their health for the rest of their life. Because with every spoonful, with every forkful, we are either feeding disease or we're feeding our health. And everybody's got to eat anyway. So we might as well be eating to feel and look our best so we can enjoy our health and vitality for as many years as possible.
Yeah,
that's well said. So we like to, on the show, give people, really empower people and help them to feel positive about a condition that they might have or want to prevent. So we know there are a lot of factors that can affect our bone health and, risk of falling, which is obviously critical. So what are some of the risk factors that we can take control of and feel empowered?
Oh, what a great question. There are so many. So one is if you have osteoporosis and you want to reduce your risk for falling, one of the things is just to fracture-proof your home. If one of the dangers, most people who break a bone, it happens in their home. So throw rugs are deadly. People can, especially if you shuffle, can catch their foot on it and fall. That actually happened to my mother-in-law. That's how she broke her leg. And so get rid of throw rugs. Look for, put grab bars in, make sure that loose steps are fixed, make sure there's adequate lighting in hallways. If you get up at night, especially to go to the bathroom, that obstacles are out of the way. And I go through this as well, and this checklist that people can have or should have in that chapter of the book as well, to fracture proof their home. So that's one thing. The other thing to do is diet. There's a lot of benefits that can come from improving your diet, and that's something that we can control. Another thing is sleep. If you're having sleep challenges, to work on improving your sleep. And one thing that a lot of this I haven't seen in any other osteoporosis book in this way, but one thing that I've never seen is there's a whole chapter on there on connectivity. And that's making sure that you're connected to your community. And I've had people ask me, well, what does that have to do with your bones? Well, here's what it has to do with your bones. Research shows that when somebody has a healthy support network, when somebody is involved in their community and they're volunteering, not because they're trying to improve their social status or they're trying to get that promotion at a job, but they're volunteering because it's something that they're passionate about and they want to give back and they like it and they're excited. The risk for dying from any cause is reduced. It reduces all-cause mortality, which includes reducing the risk of dying from osteoporosis. So that's important in terms of a holistic approach to you don't have to do everything at once. In fact, for a lot of people, maybe it's overwhelming. But the research is also clear. When somebody starts taking a positive step in one domain, in one area, whether it's exercise or eating healthier or managing their stress better, what happens is they start to build on those successes. And as they start to do that in one area, then they're more likely to start doing it in other areas of their life. So no matter where somebody's at, there's something in this book where they can say, okay, this is attainable. I can start here. And I'm a big believer that we need to meet our patients and we need to meet our clients where they're at and help them on this journey.
Yeah. Very good. Yeah, it crosses everything, crosses all aspects of our life to be healthy and vital as we age. So why not apply it to this as well? It makes sense. I know, as we started talking about food, I started thinking, there's a lot of people that think when they start to apply some kind of a food plan to something, a condition that they care about, they also start to think about supplements too. And I know that there are so many bone health supplements on the market. Can you give any guidance as to which nutrients, if somebody needs a supplement, they should pay more attention to versus not? I'm not asking for an overall recommendation because everybody's different and unique, but I'm sure there are certain nutrients that matter more if somebody is going to choose something like that to augment their diet.
You're right. And I think augmenting their diet is an important concept. I do believe that dietary supplements should be used exactly as they're intended by the FDA and as the name is explicitly intended to convey. That is a supplement to a good diet, not a replacement for diet. Right. I think that your question, though, for me is important then when in answering it, to step back and say, okay, what is the most important question with osteoporosis? And how do dietary supplements relate to that? So a little earlier, I said, you can essentially frame any recommendation and view any recommendation through the lens of one simple question. Has what I'm being recommended been shown in clinical trials to reduce fractures? And so we can look at the dietary supplements and the nutrients used in dietary supplements through that lens as well. There are only 4 nutrients actually that have been shown in clinical trials to maintain strong bones as indicated by reducing fractures in clinical trials. Those are calcium and vitamin D, a form of vitamin K2 called MK4. Now, there are 2 forms of vitamin K2 people are probably familiar with that are in dietary supplements. There's MK4 and MK7, but they have different names. And as you might sort of understand, they're different molecules, although they're both forms of vitamin K2. In biochemistry, if you change one atom, one carbon atom, for example, it can change the activity of the nutrient. So MK4 and MK7 have overlapping but different roles and activities in the body. MK7 has never been shown in any clinical trials to reduce fractures as the endpoint in those clinical trials, showing that it maintains strong bones. Both MK4 and MK7 can promote and boost bone mineral density, but bone mineral density only predicts 44% of women who will break a bone and only 21% of men. In contrast, the MK4 form of vitamin K2 not only promotes healthy bone density, has been shown to promote healthy bone marrow with healthy platelet production and red and white blood cell production. It's the primary form of vitamin K that accumulates in tissues throughout our body. So MK4 accumulates in the brain, in breasts, in the intestines, in the pancreas, in the testes. And so it suggests that it has a lot more activity in the body beyond just bones. But with respect to bones, there are clinical trials. There are 5 clinical trials that actually looked at whether MK4 can maintain strong bones as indicated by reducing fractures. And the clinical trials showed that yes, and meta-analyses of the clinical trials, 2 meta-analyses have concluded the same, that MK4, 45 milligrams per day, has been shown and can maintain strong bones as indicated by reducing fractures in the clinical trial volunteers by more than 70%. The other nutrient then, the 4th nutrient that's been shown to reduce fractures is strontium. It's a mineral, and it's been shown to reduce fractures in the amount about 43 to 45%, mostly shown in vertebral fractures. Most studies have not shown hip fracture reduction, which is the most dangerous type of fracture. And all of the studies were done on a form of strontium that is called strontium ranelate. Strontium ranelate is approved as a medication in Europe, most European countries, for osteoporosis, which is important because in the United States, it's a dietary supplement, and no dietary supplements are approved to diagnose, treat, prevent, or cure a disease. And the form of strontium that has been studied, strontium ranelate, is not what is available and provided in dietary supplements. It's strontium citrate. Now, strontium citrate may still have that same benefit, or the same benefits of strontium ranelate, but there just aren't any studies showing that. What we do know about strontium, though, that for me is a reason to think twice about taking it, is there are a couple of reasons. One, strontium is a mineral, so it incorporates into the bone like calcium. A bone density test is an X-ray that an X-ray hits the minerals and it bounces off the minerals. And then the computer detects that angle, the angle at which the X-ray bounces off the minerals, and it does its magic and its calculations, and it spits out the bone density test result, the T-score. Well, strontium, because it's a mineral, it's actually heavier than calcium. So it incorporates in the bone, and it's not part of the algorithm within the bone density test machines in the United States. They can't correct for that. And so the X-ray comes in, it bounces off the strontium at a different angle than the calcium. And what results is a false bone density test result. So the bone density test results that people get can be inaccurate. So that's why that's one of the reasons why I hesitate. The other is because there's some research that has come out, and people have looked at European regulatory data and published studies on the safety of strontium as strontium ranelate, because that's really the only safety studies we have, show that it actually increases the risk for blood clots, venous thromboembolism and pulmonary embolism, a dangerous blood clot in your lung. So much so that the thought is now that for every one patient who's helped with strontium ranelate to reduce a fracture, help them with their osteoporosis, one patient's going to get a blood clot. So that's why I'm just not a fan for those reasons of strontium. Whereas you just don't have those safety risks at all with the MK4 and the calcium and the vitamin D. And calcium and vitamin D have been shown to reduce fractures about 18 to 20%. When it's combined with MK4, that benefit improves in terms of strengthening and improving bone health. It appears in the clinical trials. So with the vitamin D, if you want some little more information, this is all in the book as well. I do think it's important that people get their blood levels tested of vitamin D, because the vitamin D level that's been associated with a 20% reduction in fractures is when that blood vitamin D level gets to between 30 and 44 nanograms per milliliter. so that you really want to make sure you're getting into that range. For other benefits of vitamin D, people may be familiar with the immune boosting or immune supportive benefits of vitamin D. The research indicates or is pointing to likely a benefit for immune health at a higher amount, maybe 50 to 60 nanograms per milliliter, which is what a lot of integrative clinicians will recommend. So I do think getting vitamin D tested is important.
I'm so glad you said that, because those are just some details that I think are so important that can, if not said, people can use that information in a way that's not really supportive. So I love what you said about testing the vitamin D. I want to go back and just make sure that our audience heard what you said in terms of the dosage of vitamin K2, because you said 45 milligrams, right? And
Correct.
Usually most supplements dose vitamin K2 in micrograms, which is a huge difference. So this is a very different, distinct recommendation than what is in a typical supplement for vitamin K2. So I just want to make people aware of that.
And when you see those microgram doses, you need to look at the form of vitamin K2. Typically, that's going to be the MK7 form, not the MK4 form. And it needs to be that 45 milligrams per day of the MK4 in divided doses. That's what's been shown to promote bone health and maintain strong bones in the clinical trials.
So they may want to work with a nutrition professional to find that kind of a supplement, because it's not going to be something that you're going to go grab off the shelf somewhere at the store, likely.
They're correct. And in fact, if I may, a little bit of my backstory of how I also I started my dietary supplement when I was in a supplement company. When I was in clinical practice and started looking at and I was using a lot of nutritional medicine with patients, I couldn't find, in terms of helping them with their bone health, as I discovered this research and was getting deeper into the research, I couldn't find any products on the shelves that had the dose and combination of the nutrients shown in clinical trials to work, not only for bone health, but for other indications I was working with them on as well. So I created a company to create the first product that actually in the US that had that clinical dose of MK4 plus calcium and vitamin D in it, all combined in one product. And since then, we've shipped into 15 countries, and we're distributed by distributors to healthcare providers and practitioners, and it's just been amazing to be able to provide that solution.
And I don't want to go too deep on the supplements, because I don't want people to just feel like this is the answer, because it's not. It is augmenting. But could you just touch on calcium? Because I see people that are taking lots and lots of calcium. And is there like a maximum that you recommend, or maybe a sweet spot on dosing and a type of calcium? Because I feel like calcium is probably misconstrued in how we're using it.
So there is some safety concerns when it comes to calcium with emerging research. And the clinical trials and the reports are showing that if you're supplementing with calcium, it should be 1,000 milligrams or less, no more than 1,000 milligrams of supplemental calcium. However, as I mentioned before, a dietary supplement should be a supplement to a healthy diet. So the US RDA for calcium is 1,200 to 1,500 milligrams a day for adults. The average American woman gets about 800 milligrams of calcium from their diet. And so taking 400 milligrams of calcium in a dietary supplement is going to be sufficient for most people to get into that healthy US RDA range, which is why, I actually have, I created two variations of, Osteo-K. My product, one of them is 1,000 milligrams of calcium in it, plus the MK4 and vitamin D. And the other Osteo-K minis provides 400 milligrams of calcium per day, plus the vitamin D and MK4 to meet those different needs of people. And the recommendation of the American Heart Association is, and the association, I believe, is for preventive cardiology, is that not to surpass 2,000 to 2,500 total milligrams of calcium per day. And so you really, supplementing, when you look at the clinical trials with calcium, we don't want to supplement higher than 1,000 milligrams a day. And ideally, you're getting most of it from food.
So I know we have to let you go in a little bit here. Just you have time for a couple more questions?
Sure. I love this. Yes.
Okay.
Yes, absolutely.
So we could keep you for another 2 hours if I didn't want to be rude. But so at the beginning of the show, I alluded to the fact that your book and this podcast is for everybody. So with that said, when should we start caring about our bone health? And is it ever too late to start caring about our bone health?
So we should start as early as possible. My wife and I, with our children, have been talking to them about their bones since they were, itty bitty. It's never too young, because you can't see your bones, and it's a silent disease, meaning there typically aren't any symptoms until one day, you're walking along or you fall and just snap, you break a bone. And so understanding the fundamental role that bones have, that it's part of you, produces your blood and your immune system, and having appreciation and instilling that appreciation into children when they're young is something that I passionately advocate for. It's never too late to start. That when, a lot of these recommendations in the book are good for any age. I mean, not little kids, but for adults at any age for adults. And definitely with teenage girls who, as they get older, are going to be at a much higher risk for osteoporosis. It's really important to, I think, mention it along the way. It's not as though, you have to have a, big sit down conversation, but, we drop little crumbs, with our kids, over time of what they're eating. Oh, that's bone healthy. Or they're exercising. It's like, oh, that's great for your muscles and your bones. Just things like that to gain an appreciation. And there are other practitioners out there who I think are doing a phenomenal job of helping to educate, working with teenagers and working with people with osteoporosis with exercise. And so it really takes, I think, a team approach. And any angle that people want to come at, whether it's the nutrition or the exercise or the lifestyle modifications or the medications, or, the list goes on and on. Whatever it is, wherever somebody's at, there is something they can do to improve their odds.
That's so good to hear. Even for my mom, who's, maybe facing medications or whatever she is at her stage of life and her risk factors, there are still things she can do. So I'm talking to you, Mom, right now. Let's see what we can put in your day-to-day activities and just continue to build on that bone strength and bone health. So it's awesome. It's never too late. I love that message.
I know that gave me goosebumps. That was a goosebump moment. So you're just sharing some of the things that you do with your family in regards to what's healthy for your bones and your muscles and that sort of thing. But talk to us about all of the things that we talked about today. What do you do personally in your life to make sure that you have strong, healthy bones moving forward?
So what I've done with my life, and it's taken years of trial and error, and people need to really discover the systems and what work best for them. What we've done, what I've done, what my wife and I have done, we've really tailored our life and our daily activities around being healthy while we get things done. We're both busy professionals and we have kids, but for example, there are simple tricks that research has shown can help develop healthy habits easier. For example, if you have snacks in your cupboard, putting them at eye level so it's easier to grab. If it just takes a split second less to make a decision to grab something healthy, somebody is more likely to do that. But if the chips and the high fat and salty snacks, the package, are right at eye level, but the healthy stuff is down below or up high, people are going to do what's easiest. So create your life so that being healthy is easier. When you open the refrigerator, the fruit, the vegetables, they're right there, eye level. Reach in and grab them so our kids can grab them. We can grab them. Likewise for exercise. If you can shave just a few seconds off the amount of time it takes you to start exercising, If you can reduce what's called the friction of doing something, you're more likely to develop a healthy habit. So what I've done sometimes, and it's changed over time depending on my situation, and that's, I think, another thing, is to be flexible. Learn what works for you, change it as your situation changes. But for me, sometimes, and I get my workout clothes ready, and I work out at home typically, and I literally drop them in the middle of the floor. So I have to walk over them. I don't have to go into my closet to get them and pick them out. When I go into exercise, it's just easier to put them on. Or if I don't have any meetings or have to go out, I'll get dressed in the morning and I'll just get dressed in my workout stuff, because then I can just do it. There's nothing else I have to do to get started. Another thing is also to realize that it's important to have compassion for ourselves, and to realize that this is a journey, and to celebrate the little wins. When people focus on how far they have to go, how long the road is, how far they are from their ideal, it can become super overwhelming. And I think it's better just to focus on today. And in fact, I'll say that if I'm feeling overwhelming, if I fall off the wagon, which I have, we have August and early September is a crazy month in our house. We have 3 birthdays and my anniversary, my wife and my anniversary, and back to school. And so that's a time of year where oftentimes, where I'm eating really healthy, I'm going to be indulging more, and I kind of fall back.
So there's cake. There's a lot of cake in your house.
Yes. Yeah. That time of the year. Absolutely.
Sounds delicious.
Yes. So my wife has this thing, and I love her for it. It's very endearing. You have to blow out a candle on your birthday. You have to.
Yes.
Right. So it's very sweet. But when I get that way, what happens when you are not eating healthy, it can increase the amount of inflammation going on and water retention. And so you don't feel as good. And so it can feel harder to get motivated to get back to eating or start eating healthier again. And so when I'm feeling that way and I become conscious of it, instead of feeling overwhelmed and saying, oh, I did it again, or now I gotta get back to where I was, what I say to myself is, just today. This is a trick that works very well for me. Only today. All I have to do is eat healthy today. All I have to do is exercise today. That's it. And then tomorrow, I tell myself the same thing. And before long, 2, 3, 4, 5 days, I'm back into a healthy habit. I've developed a healthy habit again.
Love that. You're making it easy, right? You're making it easy for yourself. You're making it easy for the patients that you work with, and giving us all tips on how to make it easy, so it just becomes part of life and it's not the extras anymore. I love that. We appreciate so much you shedding so much actionable light on this topic for us, and giving our audience a way to take hold of this and be proactive with their bone health and just their health in general. So can you tell us more about any resources that you might have out there? We know we've got the book, wonderful, Fracture Proof Your Bones, that just came out recently. So we know about that. But are there some other resources you'd like to point our audience to?
Yes. So my website, nbihealth.com, has hundreds of blogs. You search for practically any topic, and you're going to find multiple blogs. Yes, there's the book. The book is available there on the website. There's my podcast. I am the host of the Delivering Health podcast. We have a newsletter that goes out every week that people can subscribe to and get that. I like putting out information to empower, and practical information to help people take action. So those are some of the resources that are available through nbihealth.com, as well as my dietary supplements are there for people to look at. And if it's a good fit, you can review all the research. Those are available as well.
Any social media?
Oh, right. Oh, my marketing, my CMO would be.
You're welcome.
What are you doing? Thank you. Yes. We've got Facebook, Instagram, TikTok, although I'm not as I was told I have to do TikTok. I'm not good at social media. I'm much more of a nerd. Like, give me a stack of medical journals and just close me in a room for a day and I'm happy. So they told me I got to do these videos, and I love them. My team is phenomenal. They're great. They push me out of my comfort zone a little bit. But anyway, so there's a TikTok channel. And in fact, today it'll already be published when I think out there. If people want to go, I'm going to post a video of our daughter who had a surgery, had some teeth extracted to get braces, and she's coming out of anesthesia. And she said we can post the video, so I'm going to put it on my TikTok channel. It's hilarious. It's fun.
What is the title of your Instagram and your TikTok? And
Instagram is at John Neustadt, and that is the same with LinkedIn. The Facebook page is NBI Health, and Instagram and TikTok is Dr. John NBI.
Perfect.
Yeah, I'm gonna have to get my kids to pull up that TikTok for me because I haven't gotten into that. But they would have killed me if I'd posted anything like that about them. So you must have a great relationship with your kids. That says a lot.
She's a good sport. She's a great sport.
For sure. Well, we have used up way more of your time than we intended. We cannot thank you for being so generous with our audience. We really, really appreciate it.
Oh, thank you. I had a wonderful time. Thank you for allowing me to share what I've learned.
Yeah, so everybody pick up the book, send it to all your loved ones, and please like this episode and share it. This is just would be so helpful to listen, for anybody to listen to. So please share it. And thank you so much for watching and listening, and we'll see you next time. Take care.
Take care. Thank you. Bye-bye.
If you'd like to access other episodes or subscribe so you don't miss a beat, you can find us at nanp.org/NANP-podcast.
Membership in the NANP provides you with a competitive advantage. Whether you're a current practitioner or a student, we want you to become an active, informed leader of the holistic nutrition community and join today at nanp.org. NANP is very proud to provide the highest level of professional recognition and validation in the holistic nutrition industry through the board certification and holistic nutrition credential. To earn this valuable designation, candidates must demonstrate an exceptional level of knowledge and understanding of holistic nutrition by passing a board exam and documenting client contact hours. Are you ready to boost your credibility with board certification? Visit nanp.org today to apply.
Keep in mind that the information on the NANP podcast is for educational purposes only and should not be considered medical or legal advice. The NANP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NANP and all agents. Copyright NANP, all rights